A 30-year-old patient with poorly controlled hypertension, which is high blood pressure, so increased BP, has difficulty adhering to a new low sodium diet. Which of the following strategies is most likely to improve the patient's dietary compliance? And remember, the reason it says most in all caps is because there might be a few answers that work possibly well for this patient because we don't really know them specifically, but there's one that would work the best. So let's look at the choices. So option A says, explain the long-term risks of uncontrolled hypertension in a lecture format. And that's why this question says most likely, because we don't really know any information about this patient other than the fact that they're 38 years old and they have poorly controlled hypertension. So when it's saying lecture format, to most people, the average person, they wouldn't want to sit and listen to an entire lecture. They'd rather have a regular conversation that's personalized to them. So the reason this says most likely is because maybe on the off chance this patient is interested in lectures, this could possibly work for them, but there's probably a better choice here from the other options. So we will eliminate it for now. Option B says, provide the patient with a generic low-sodium meal plan without considering their preferences. So here's the key. Without considering their preferences. We always want to consider the patients whenever we're making a plan with them. Patient-centered care means having them at the center of everything we're doing and considering all aspects of their life when we are helping them with any challenges they're facing. So if we're not going to consider their preferences, then just taking a generic one-size-fits-all low-sodium meal plan might not actually be effective for this patient, and therefore they might continue having trouble adhering to the diet. So we will eliminate option B. Option C says, collaborate with the patient. So collaborating, that looks good. We want to work with the patient to identify specific challenges and develop a personalized dietary plan. So this looks good. And unlike in option A, when we saw lecture format and we were saying maybe some patients would like that, but overall it's probably not effective. Here, when we talk about collaborating and we talk about identifying challenges and developing a personalized meal plan, this is something that would work for most all of our patients, because if we're collaborating, we're working with them, we're going to find out more about, right now we just know a 38-year-old with poorly controlled hypertension. We will learn more about them and we will get to the bottom of, oh, it's poorly controlled. Well, why is that? How come? Is there something in particular that's making it challenging? Is it that you're having trouble finding foods that you enjoy eating still, or just with your lifestyle, you're having trouble finding the time to get to these meals, or is it that financially you're finding this difficult? So we're getting on the patient's level to help them best find a solution to this issue. So therefore, option C is an appropriate choice. Option D here says recommend commercially available prepackaged low sodium meals. And again, this comes back to the most that we're looking at, that, okay, that might work for some patients, recommending commercially packaged low sodium meals. However, option C is more specific and gets to the level of what this patient needs specifically, so we can eliminate option D. Option C is the best choice here, collaborating with the patient, identifying challenges, and developing a personalized dietary plan with the patient.